So, what is the absolute most dangerous red flag hiding behind chronic constipation? I mean, is it just a harmless everyday annoyance, or is your patient's body literally screaming that there's a much darker systemic issue going on? Hooked? Good. Because today we're going to decode the GI tract like never before. Welcome back to Confused Neuron. I am so incredibly pumped you're here. Today, we're bringing out the clinical whiteboard for a high-energy explainer on the pharmacology of laxatives. I'm going to map this all out for you, using some serious structural flow to make these tough concepts actually stick. We'll map out the pathophysiology, the mechanisms of action, and the critical treatment algorithms you absolutely need to know. So grab your mental markers because we are going to write what we say and say what we write. Let's get right into it. All right. Kicking things off with Section 1, the constipation conundrum. Now, what's really interesting here is that constipation isn't just a strict numerical value. Look at the emphasis here on compared to an individual's normal pattern. It's defined as a decrease in the frequency and liquidity of stool based on that specific patient's baseline. Because what's totally normal for one person might be entirely abnormal for someone else. You always have to ask your patient what their normal looks like before you can even think about diagnosing a deviation. But here is where we really need to be careful. Pay super close attention to these red flag symptoms. Imagine I'm drawing a massive red arrow pointing right at these. If a patient presents with a persistent, unexplained change in bowel habits, especially an older patient who's always been regular, you need to look for these. Unexplained weight loss, iron deficiency anemia, nocturnal symptoms that literally wake them up at night, a palpable abdominal mass, or rectal bleeding. If you see any of these, constipation might just be a symptom of something much worse, like an acute bowel obstruction or even colon cancer. Do not just throw a laxative at a red flag, okay? Moving right along to Section 2, stimulants and bulk makers. Okay, so the absolutely crucial point here is organizing your knowledge. It's like a giant puzzle. There are 6 main classes of laxatives based on how they actually work. Stimulants, bulk-forming, saline or osmotic, stool softeners, lubricants, and chloride channel activators. Go ahead and take a screenshot of this list for your notes because we are going to systematically break down every single one of these on our mental whiteboard. Let's kick things off with the stimulants. These are the drugs that physically push the stool. Over on the left side of our board, we've got Senna. It's a natural anthraquinone glycoside that basically causes water and electrolyte secretion right into the bowel. It usually takes about 6 to 12 hours to kick in. Then, on the right, we have Bisacodyl. This one is a potent stimulant that acts directly on the nerve fibers in the mucosa of the colon to induce peristalsis. It is highly effective, for sure, but because it actively triggers cramping and motility, it is definitely not meant for long-term everyday use. And that brings us to a confused neuron pro tip. Let's highlight this side effect in bright yellow. Senna has a very specific, totally terrifying, but ultimately harmless side effect. It can literally turn your patient's urine brown or red. I mean, imagine the panicked phone call you'd get from a patient who thinks they're bleeding internally. You have to warn them ahead of time. It's just the metabolites of the drug. No way is it actual blood. Next up in this stimulant category is castor oil. So when you ingest castor oil, it travels down to the small intestine where it gets broken down into ricinoleic acid. This acid is a severe irritant to the stomach and the gut, which promptly triggers some really rapid peristalsis. But here is the absolute most important contraindication, so let's circle this in giant red marker: pregnancy. Seriously, guys, here's another massive pro tip. Never, ever give castor oil to a pregnant patient. Why? Because that ricinoleic acid doesn't just irritate the smooth muscle of the GI tract, it can actually cross over and stimulate uterine contractions. Yeah, unless you're the OBGYN actively trying to induce labor, keep the castor oil far, far away from pregnant women. Plus, it's pretty unpalatable, so honestly, we rarely use it anyway. All right, let's shift from the pushers to the bulkers. Bulk-forming laxatives include hydrophilic colloids like methylcellulose, psyllium husk, and bran. These are essentially indigestible fibers. Think of them kind of like a sponge. They form gels in the large intestine, retain water, and physically distend the intestine, which then naturally triggers peristalsis. But here is the golden rule you gotta remember. You absolutely must take them with a ton of water. If an immobile patient takes a bulk laxative without enough water, you're basically creating an intestinal concrete block, which can cause a really severe bowel obstruction, and nobody wants that. Next up, Section 3, Osmotics and Stool Softeners. Let's take a look at the brilliant mechanism of lactulose. It's a semi-synthetic disaccharide sugar. Step 1. You swallow it, but your GI enzymes can't actually digest it, so it reaches the colon completely intact. Step 2. The bacteria living in your colon absolutely love this stuff. They feast on it and degrade it into lactic, formic, and acetic acids. Step 3. These newly formed acids drastically increase the osmotic pressure in the colon, drawing massive amounts of fluid inside, causing distension and a soft bowel movement. So we're literally feeding gut bacteria to help the patient poop. How cool is that? And this brilliantly illustrates one of my absolute favorite medical bore secrets. Lactulose isn't just a laxative, it is a literal lifesaver for patients with liver failure. See, in severe liver disease, ammonia builds up in the blood, crosses the blood-brain barrier, and causes hepatic encephalopathy, which leads to confusion, tremors, and even coma. Well, those acids created by lactulose in the gut actually trap that ammonia as an ammonium ion, which is then just pooped out. Lactulose effectively pulls toxic ammonia right out of the body, a real game changer. Now let's compare other osmotics to stool softeners. Osmotics like magnesium salts or polyethylene glycol, also known as PEG, are incredibly powerful. They pull water into the bowels so rapidly that we actually use massive volumes of isotonic PEG to completely flush out the gut before a colonoscopy or radiologic procedure. On the flip side, we have stool softeners like Docusate. Docusate is simply a surface active detergent. It just emulsifies fat and water into the stool to make it softer. To use a classic mnemonic, Docusate is all mush, no push. It doesn't induce a bowel movement, it just makes it easier when it does happen, which is fantastic for patients who really need to avoid straining.
All right, Section 4, Lubricants and Special Agents.
So, lubricant laxatives are exactly what they sound like. Drugs like mineral oil or liquid paraffin and glycerin suppositories work by simply greasing the tracts. They coat the hard stool, prevent the colon from absorbing any more water out of it, and physically facilitate its passage out of the body. They're super straightforward, but mineral oil comes with a massive, glaring warning label. And here is a terrifying clinical reality. Confused neuron pro tip coming at you. If you give liquid mineral oil to an elderly, bedridden patient who is laying down flat and they accidentally aspirate even a tiny drop of it into their lungs, they will develop lipid pneumonia. Your lungs literally cannot clear heavy oils. It causes severe liquid pneumonia, lymphoid hyperplasia, and massive foreign body reactions. You must always ensure the patient is sitting completely upright if they're taking oral mineral oil. Now for the high-tech special agent, Lubiprostone. This drug is a derivative of prostaglandin E1. It acts locally on the luminal cells of the intestinal epithelium, and, let's highlight this mechanism in green, it specifically activates chloride channels. This pumps chloride-rich fluid right into the intestine to assist in GI motility. It is amazing for chronic idiopathic constipation and irritable bowel syndrome with constipation, or IBS-C. Now, the main side effect is nausea, but you can easily minimize that just by having the patient take it with a meal. Finally, let's wrap up with Section 5, the treatment algorithm. I really want you to memorize this clinical cheat sheet. Imagine writing this down on your own mental whiteboard. If a patient is on chronic opioids, say morphine for cancer pain, well, opioids decrease motility and increase sphincter tone, causing severe constipation. You absolutely must prescribe a stimulant and a softener together. Senna plus Docusate is the gold standard here. If a patient has irritable bowel syndrome with constipation, you go with Lubiprostone. If you have a pregnant patient on bed rest with mild constipation, Docusate is perfectly safe. Whereas, remember, castor oil is strictly forbidden. And finally, if you see a liver failure patient with high ammonia, lactulose is absolutely your drug of choice. But before we finish up today, we have to talk about the dark side of laxatives. Laxative abuse, which is often seen in eating disorders like bulimia, or honestly just from chronic over-the-counter misuse, is incredibly dangerous. Chronic use leads to tachyphylaxis, meaning tolerance builds up, and you need higher and higher doses. It causes severe electrolyte imbalances, particularly hypokalemia or low potassium, which can trigger deadly cardiac arrhythmias. And worst of all, the bowel can actually lose its natural smooth muscle tone, creating a dependency where the patient literally cannot have a bowel movement without a stimulant laxative. It's serious stuff. Well, we've covered incredible ground today, from the physical bulkers to the high-tech chloride channel activators. So let me leave you with a final challenge to test your memory. Which laxative is a severe stomach irritant that breaks down into ricinoleic acid and can accidentally induce labor in a pregnant patient? Drop your answer in the comments below. I really hope this whiteboard session cleared up the confusion in those neurons. Keep learning, keep studying, and I will see you in the next explainer.